Thanks for being here. It's definitely great. When we started the company in 2020, everybody told us this would be illegal. Now I think we're in a room where we see it. That was not the case, and it's grown into a real, part of healthcare in Germany and part of patient care. What we see a lot, and I think you heard a lot today, is business numbers and market numbers. So the focus of that presentation is a little bit different. I'm going to do a very slight overview of where cannabis telemedicine is right now in Germany, because there's also a lot of wrong conceptions. And then we're going to dive into data, and actually data from patients, because that's very hard to get. We are the epicenter of it, so we have plenty actually. And I think it's not often enough talked about also the motivation to get medical cannabis and the experiences of patients, because I think it can help you predict also where markets are going. Just a very rough overview, because I keep hearing a lot that cannabis is legalized in Germany and recreational is there too. That is not the case. So the 3 access paths to cannabis in Germany are pretty simple in a way, because you can put them down on the slide as options 1, 2, 3, but they are more complicated in detail. One is actually home grow. Keep in mind that this is all adults only, so there is no legal access to minors, because I keep hearing also in the press that minors are getting medical cannabis. That has not been proven. I think it's not actually the case. We are in a unique situation in Germany. I think it's also unique that Germany is finally at the forefront of something in Europe, because I definitely know that everybody's looking at Germany, both within Europe and also internationally. Yes, you have even garden magazines talking about you can grow your own cannabis, and that was initially the thought of that government, to make it accessible to people at home, because you can only grow it at home, maximum 3 plants. There has been a lot of ideas about what should be the amount. Right now, it's still a relatively high amount on one perspective, up to 50 grams. If you ask others, obviously plants can get you much more, so it's more of a limitation. There's always many different opinions. I think what we can settle on is this has not been the solving solution for how do people get cannabis in Germany. It's definitely only a small friction, even if you can get seeds at local supermarkets from time to time, and it's always in the press. So that's still this hot topic. If you look at the second option that was supposed to provide access to people, it was cannabis clubs. That depends a lot on where you are in Germany. We are now at least away from 0 clubs in certain counties or states in Germany. Bavaria has been very, very restrictive and actively building kindergartens and other things to block cannabis clubs from actually opening up, and even licenses have been redacted. At least now, little more than 2 years after that law has passed. So keep in mind, a lot of that new regulation came into play on April 1st, funny enough, in 2024. So there are cannabis clubs in Germany, because I also internationally keep hearing a lot about it. But the reality is the amount of people served through it is definitely still a small fraction. So coming to step 3, if you really look at, and I think we've seen that today, because we keep hearing about market size and import numbers, etc., what has been the driving force for people getting access to cannabis, and especially legal cannabis, so not from the illicit market, but from a controlled institution with a controlled quality? That definitely has been telemedicine. That has been medical, and therefore has been telemedicine actually. Because especially internationally, people keep looking at these import numbers and trying to derive answers from that. The reality is, yes, import numbers for cannabis, and we've heard that today, it's truly an import country. Only a fraction is grown within Germany. The import numbers have been rising. Now, for the first time, there has been a small stall there, at least in this quarter. I immediately heard everywhere the market is falling and everything's breaking down. I can definitely tell you from a patient number perspective from Bloomwell, that is definitely not the case. So we are not seeing any slowdown at all. I think there's a market, there's a different market dynamics. I think there has been an oversupply of medical cannabis into Germany that has led to also the decrease in price actually, and certain market dynamics are changing. But what's not happening is that medical cannabis is slowing down. And I think it's to this day the best answer from a legislative perspective that the German government has to keep people, and we heard that today, away from the illicit market, away from the dangers and health dangers of illicit market and actually into a viable business that also, we heard that today, generates tax. I mean, we do pay a lot of taxes actually, and we employ a lot of people. Interesting to see where that cannabis comes from. Portugal is definitely catching up. It used to be Canada mostly. Now it's also becoming more of a European solution. Let's see how that develops in the future. I think Portugal has definitely done a lot of things that has increased their growth. We've heard today also that not immediately, but relatively quickly after the new government that was then installed, started to focus on limiting that or seeing dangers in that. I can tell you also it's a very humbling perspective to have the feeling that the state health minister is talking to you indirectly, never directly. I think there has never been a direct interaction actually with that office between, or at least her as a minister, between cannabis companies and her. So it's always in the press. And our learning from that has been we want to provide more foundation to those discussions, and that's why we're going to talk about data today also. It is true the initial draft by the CDU, so conservative-led minister, was very strict. So saying cannabis telemedicine is very dangerous and uncontrolled and probably even illicit and generating access to people who shouldn't get it. Therefore, the initial draft was, we're going to break this down. We're going to say only in-person consultations for all patients, maybe even the ones who are already in treatment, so big setback. Then also repeating that every 12 months, so you can do telemedicine in the meantime after initial in-person consultation, but then you have to kind of go through that loop again. And I think that was very extreme and unheard of in Germany, forbidding German pharmacies to ship cannabis, which is not OTC, but it's also non-narcotic. So it's just prescription medication as thousands of others, banning that to ship that through within Germany, which is effectively a ban of their trade, honestly, and their job. That shows you that cannabis and medical cannabis is extremely emotional, even among politicians, unfortunately to this day. The current situation is, because I also keep hearing that there's big pushbacks coming, that is effectively stalled. The gaps between the CDU and the SPD are too big, and I think even within the CDU, what I've seen is that they have seen, okay, this went maybe a little bit overboard. We want to regulate it. We are afraid of certain things, but we don't want to completely abolish this access path for patients because it's truly safer than, definitely safer than illicit market. What's interesting out of that is if you look at what is the reasoning of the health ministry. So what dangers are they seeing? What is the data you would hope that they are basing those decisions or those drafts on? And there was truly only one number, and the number was the gap between the import numbers that we've seen today, which continue to rise, true, and the amount of medical cannabis prescriptions done by local doctors through statutory health insurance, so through reimbursement. That gap could have been explained in a phone call, in an email, in 5 minutes, because that's true. It's not the increase in cannabis prescription is not coming from local doctors and definitely not coming through reimbursement, but through telemedicine. And we'll dive into that actually later. And you see it also here. This is private prescriptions versus statutory health prescriptions. If you're from outside of Germany or outside the German cannabis telemedicine market, you may think, well, private is probably pretty expensive. The reality is, at least especially through Bloomwell, that private prescriptions are effectively free, and you only pay for the medication itself. And those numbers, and I will show you, have come way down. So one big outcome has been, this has become very accessible to people. You can have a cannabis treatment with probably 20, 30 euros per month total cost, with no other restrictions there. And it's not being a burden on the insurances, because at the same time there's a discussion going on in Germany that they are, they have no money reserves left basically for various reasons. But so the growth of the medical cannabis market in Germany has not been a cost burden to the social reservists there. It's really truly separate, and I think that is also very unique, and we heard today, very unique to this healthcare situation, because usually it's definitely a different way. So when we started Bloomwell in 2020, we really only focused and we grew obviously through patient numbers, but we grew also because we started to see we have to fix more problems than we initially thought. Because at the beginning we thought this was about access to patients, to find doctors that actually prescribe medical cannabis and have experience. So we focused on patients and we focused on doctors initially. Relatively quickly realized the pharmacy supply was also broken. In 2020, you would pay 20, 25 euros per gram for cannabis flower back then. We are now down to maybe a tenth of that. And the process also wasn't working. So we quickly thought, okay, we have to actually build a solution for the pharmacies too. And then over time, we realized wholesalers have also many issues. They have often, they're unaware of market dynamics. They can't see, is the product I'm bringing into Germany, is that going to work? So now we have platforms actually for all of those four. And I don't want to dive into that. I want to just give you one solution, because one thing we definitely have, and probably no one has, as we were the first in Germany, probably even Europe, and now we're one of the largest, if the largest, cannabis telemedicine platform. What we have a lot is definitely data, because all those data points we are analyzing. And so while that was not really our focus back then, one outcome of that has been that we publish these. So I'm putting the website down here because the slides you see on the next slides, you don't have to take photos. You can just go on the blog. It's all publicly accessible, no restrictions, no registration, and often even in English. Because we report now quarterly, and it's a mix of market dynamics. So if you want to see, sure, based on our data, but probably pretty representative for the whole country, how many products are there available on these on platforms, and therefore to patients and to pharmacies and to doctors, we publish that quarterly. If you want to see how has the price of medical cannabis that's effectively paid by the patient has changed over time, because I heard today it was 6 to 8 euros. I think those numbers are now outdated. I think we're now in a region definitely below 5. Which has many implications for many companies, but keep it from a patient perspective, that has been a big driver for that growth. So we publish those quarterly if you want to keep updated about that, and therefore also effective prices. We report even average THC concentration, etc., for the lack of a better number. So if you want to keep updated, just go on Bloomwell blog. We publish these quarterly, often also with press releases, because we want to provide data to everybody involved. And so for the second part of that presentation, we often hear about patients and what patients do and what doctors do, but very rarely are they actually asked. And we did just that. Because for us, obviously, through an app, through the platform, it's very easy to roll that out. So also if you have ideas for collaborations, we can do that and get that data. So I'm presenting, this is all public. So again, you can see those slides also on the website if you download it. But we first went as one of many of these barometers that we call it, and asked patients, because I think the reasoning for medical cannabis is definitely not asked by lawmakers to patients, but it's often also not asked by industry. So, because if you go back, you heard you saw that the ministry is saying, well, those are not prescriptions going through reimbursement, going through local doctors, which kind of implies, well, maybe they also haven't asked. The reality is that a large amount, even the majority of patients, obviously go to a doctor first and ask them, can I get medical cannabis for you? I heard about it. I think it could be good for me. The reality, and we're going to dive into that a little bit, is that the majority of doctors just say no. There's many reasons. I have many doctor friends. I'm a medical doctor originally too. So I think it's also there too easy to say, well, they're to blame or something. No, they have their reasons. They're definitely not to blame. It's a complicated situation. But if you want to provide solutions, you have to go a different way. So please strike from your head the idea that people go to private platforms immediately because for whatever motives I've heard in the press, the reality is they often talk to their doctors. Then even if the doctors, and we've seen that often, even if the doctors are supportive of medical cannabis treatment and say, this could be a good solution for you, they even then often say, I'm still not going to do it through my signature, basically, through my office, for many reasons. So even if you bring it up with your doctor, the rate of then effectively being treated with it, and even just one prescription, is very low. So you can also see if many patients have experienced that, and here we've asked 3,300, they will often also from the get-go not even ask their doctor because they have heard from a friend, well, you can just save the time go into the office there. So the reality is, and that for that number the health ministry is claiming is easily explained, local doctors don't prescribe medical cannabis. What's more dangerous is what are they doing instead? And we will go into that also even from a doctor perspective, because yes, they are prescribing something else, and it includes obviously also narcotics. And for narcotics, the health risk has very much been proven over decades. We have an opioid crisis in the US, and we have an opioid crisis in the US, and I think we do have actually one also in Germany. But so the likelihood of you going to your doctor and saying, can I get medical cannabis, and the result being no, definitely not prescribing it, not supporting, but definitely not prescribing it, but prescribing something else is extremely high. And that's a reality in Germany, and that's the reasoning why people go to medical cannabis telemedicine platforms. Because obviously, yes, they're specialized in it, as also a local eye surgeon is specialized in, cataract surgery and not just everything else. But they don't want to go through the experience of rejection and many things that also I think are emotional are a factor actually. And we're going to dive into what are doctors prescribing elsewhere, but that's the reality for patients in Germany. Because, and that number really shocked me when we asked it actually, they are not only prescribing something else, they are effectively prescribing narcotics. And if you've worked at an ER, and I have in my training back then, even just taking narcotics for a long time has definitely proven health risk, has a risk for addiction, therefore also a high rate also of withdrawal. We've seen that in the US. And that likelihood is surprisingly high in Germany. It's very, very easy or quick, you want to say, to get prescribed a narcotic in Germany with all the health detriments in there. So if people are saying there's an opioid crisis in the US, but we're doing much better in Germany, I can tell you I've personally prescribed hundreds of narcotics when I was a medical doctor at the hospital, because you're out of options and you've been primed that way. You get a WHO chart that says if the other pain medications don't work, go higher up, and you're very quickly at a narcotic level. So when we saw that number, obviously, we had to take the next step. We had to ask the doctors, what's going on? Because if you ask patients, sure, and this is also, keep in mind, this is not a peer-reviewed, we have peer-reviewed studies, we have independent studies that were published based on Bloomwell data, so we've done our part also in research, I think, but if you want to get closer to the truth and the market truth, you have to ask directly, but obviously you're getting only one side of the coin, which is what are patients saying with very different backgrounds, experience, etc. So we went out through a third-party provider and actually asked doctors about their experience with medical cannabis and their pattern for prescription or non-prescription. And so the reality is that only a tiny fraction of doctors in Germany and family doctors, which is like a general practitioner in Germany, have effectively prescribed even just a single patient with medical cannabis back then. Keep in mind that the law was changed back there. So before the doctors actually had to, apply in the name of that patient with the insurance to get reimbursement, that was changed. That was thrown out the window. So it should be much easier for doctors because they, at least theoretically, have no one to apply to or to report to. They just prescribe it and it goes into a database. The reality is that the law change that was supposed to fix medical cannabis with local doctors and also fix medical cannabis reimbursement by reducing controls over it didn't have that impact. And I think we've seen that from the slides from the patient questions, because there are, I think, still a lot of ideological factors, but there's also other reasons for medical doctors in Germany not to prescribe cannabis. And so even just treating one patient would be a step, but the majority, if you raise that number a little bit and you say, okay, have you treated maybe more than 6 patients since 2024? And these are current numbers, so they're coming from within the last 6 months. That number gets even lower, and that completely explains the difference. So therefore, we could have explained in an email to the health ministry what's going on in Germany. Unfortunately, that discussion was never happening publicly. So as I said, don't jump on and blame the doctors. There's many reasons, because we asked, what is the reason that you're not treating with medical cannabis? And sure, there's a reason where you just say, I don't think it's the right medication for that patient. That is obviously an amount of patients. I think it's big enough, yeah, that works. Education and training is a big factor. I mean, if you go through medical training, you have both med school and you have the specialty training. I did both, and I can tell you from first experience, from a little outdated now, I finished studies in 2012, 2011. Cannabis doesn't pop up. You hear about in biology, okay, there's an ECS, you hear about there's a cannabis receptor system, but that's it. It's a quick laugh in those presentations, then it's over. So it hasn't found its way into medical training, neither at a university level nor at a specialty training level. And I think a lot of companies in this room are also doing training for that for local doctors. But nevertheless, if you ask them directly, I think the insecurity around it is still big. So it's easy for doctors to say, okay, I would rather just not do it at all, because then I have a simple answer that I can tell patients, I'm just not prescribing it, even if I'm supportive of it. Although the regulations went away in a way that you don't have to apply anymore, there is still political pressure by the insurance companies on doctors. I've personally seen letters where insurances are warning doctors of prescribing medical cannabis and warning them that there could be potentially, theoretically, later on, years later, there could be a risk that they would have to pay back as a doctor for the treatment that they did for the patient. So I would say that although legally you can see legally it's changed, politically there's still pressure on doctors, and the likelihood for them to say, I just don't prescribe medical cannabis at all, is therefore much higher. We wanted to go again deeper because we saw from the patient's query that they're prescribing something else, and that actually shocked us a little bit also, because what we saw here was that doctors are, again, and they're confirming it, they're very quick to prescribe a narcotic. And we even, because we wanted to dig deeper a little bit, we told them, okay, here's a case example that I think in many cases would suffice for at least saying, okay, we're gonna do a test of medical cannabis in this patient and we're gonna see if that works for you. So we gave a case example of a relatively young, 36, depends on how you look at it, man, but with a history of 2 herniated discs, has done all the necessary steps, also according to the WHO protocol, is already taking tramadol. If you've ever taken tramadol, which can be a narcotic or can be prescription, depends on if it's soluble or if it's a pill, I can guarantee you will notice it. I've personally prescribed it to many people, and they all report severe side effects. So not only actually a risk for addiction to it, but really feeling under the whole day that they take it. It's really a strong medication, but in emergency services, especially, you prescribe it constantly. So we thought this would be a reason to take medical cannabis, because we've seen and used in other publications, and actually the last one came out just a few weeks ago, where patients have been reported that thanks to medical cannabis, they are now away from narcotics. They have stopped taking narcotics completely, they have stopped taking severe pain medications, and they have gotten rid of the side effects of it. We gave them the example, and again, truly only a fifth of local doctors said, I would consider actually prescribing medical cannabis in this case. And I think that gives you the true deep dive into why is the medical cannabis treatment in situation in Germany the way it is, and why is telemedicine booming the way it is, because there you have the specialized doctors who actually treat many patients. So the likelihood of you going, it's a workday, going to a local doctor in Germany here and actually getting medical cannabis from them is extremely low. Through telemedicine practice, that is definitely different. So that is, in a quick overview, the deep dive I wanted to do. I wanted to keep it relatively short. So if you take any conclusions from this, I wanted to break it down very simply, because the data, you can just get the slides if you want, it's all online. But the reality is, and I think also in this room, unfortunately, everyone's talking about patients and their dynamics, everyone's talking about doctors, but very, very rarely asking them. We are, and that's why we're open also for collaborations on that, although it's not our main business or anything, but we've taken it on because we think it's crucial to provide the data, and we also provide the data to the government. If they read it, it's a different question. Some do, from what I hear, many don't. But we will continue to do and make patients heard, because in the end, it's about them, and I think the dynamics to a much lower price, although that have been stressful for companies maybe in some, have been great for adaptation of medical cannabis. I think now it's much more normal to be a medical cannabis patient than 2 years ago, than 4, 6 years ago, and hopefully that trajectory continues. But we're still very far away. For me, the litmus test is, you know, in Tatort, which is a famous German TV show, if someone would take medical cannabis there, would they make a big thing out of it? Or is it normal because you see them popping pills on TV all the time and it's kind of normal for a cop on TV, I guess? Cannabis would be a big thing. I think all the newspapers report about it. There we're still not at all, but I think we're getting there. And what we're seeing now also from the legislature, and that's my second point, is that telemedicine is the preferred way of patients for many reasons, and these are not illicit motives or reasons. And I think in a government where we're also seeing from especially the SPD a more focus on digital medicine, and not taking the step back, it's here to stay, definitely, and happy to adapt. We do many things actually as a platform that the government hasn't been asking for. So, for example, we do verified ID checks. We do obviously therefore verified age checks, etc. Many who are operating in that space don't. So I think we're trying to set the standard there in a way. But let's see what happens in the next months and years to come. Always happy to reach out, and yes, we are bold obviously also in our marketing effects because you need a conversation going. I have seen many people who have seen the Bloomwell bus. This is not a rendering, this is an actual bus that drives around through Germany, especially through the big fairs. So if you're in Berlin next month, you'll definitely see it if you're on site, and to get a conversation going, because I get asked by the press also, isn't this too pushy in marketing? But the reality is, and we've seen that also in the data, it's very rarely direct, meaning what you often have, you have a growth in elderly patients getting medical cannabis, but they don't get it because they saw a blog post or a website or a bus. They get it because their nephew saw it and started thinking, hey, maybe this is better for you than all the narcotics that you've been taking. So please keep in mind also when you talk about patients, it's also about patient education. And I'm not an educator there, but indirectly, through families, etc. And so I think it's good to keep the conversation on cannabis because in the end, this is definitely the safest access to cannabis that we have in Germany and probably Europe. Thank you for your time.